This is your friendly reminder that if you are renewing any benefits through work or just through insurance online or through your own separate plans, opt in for an HSA FSA plan, because this is a therapy hack if you actually want to be able to go to therapy and get a really, really great clinician and be able to have more autonomy over your care. Here's why. With an HSA account, they take money out of your check every single time and they put it into HSA FSA dollars, where it's basically a check card. You can use that for therapy. You can use that for other stuff, but I'm not going to talk about the other stuff medically because I'm going to stay in my lane. Okay. I just only know what I know. But this is a way where you can decide who you want to work with and pay out of pocket for therapy and have a better therapist who's not burnt out, seeing like 13 clients a day, billing insurance, where they're a zombie, where they're not actually present for you. And especially in a mental health crisis that we've been in over the last 5 years, more people are going to be going to therapy this next year 6, 7, and 8 at least, and then more even after that. So this is your friendly reminder that if you're updating your insurance plans, maybe opt in for an HSA FSA, so then you can build that therapy budget or that health budget here overall, where that money is easily taken out. It builds up over time. Those dollars never expire, and you get that autonomy over your care. And another reason why too is because then you can also pay and work with private pay clinicians. I've said this on my channel before. I'll say it again. If you were to go and work with somebody in your state for sex therapy, a lot of sex therapists do not bill insurance because it's not paid through insurance. Couples therapy is not always paid through insurance, and if it is, it's at a lower rate. And same with family therapy as well. So that's why a lot of sex therapists do not pay for or take insurance, because a lot of their clients also don't meet criteria for diagnoses here overall. And that's something to be mindful of. Do you want your insurance to know your diagnoses, especially if it's linked to your work and anything like that? So there's a lot of things to consider with this Shameless Squad. I've written blogs about this over the years. I've talked about this so much on my channel. I've written posts over different types of social media platforms that I don't really use anymore or have anymore. They're deactivated. So I wanted to say this again. If this is something that you're looking at your benefits right now, look at an HSA FSA. And if you want even more autonomy over your care, an HMO plan is when you have to go to a provider through that list. So they technically have lots of wait lists. Sometimes they're swamped, and that could take months to years to even see somebody, depending on where you're at with access and availability. A PPO plan is also where you can pay someone out of network with benefits, but then you might also want that HSA, because then you can go outside of your insurance here as well. So this is one of those things. A lot of people don't realize this, but you get what you pay for with therapy here overall. Amazon Prime is kind of like the insurance of therapy. If you want the Rolls Royce of therapy, HSA, FSA all the way, or private pay all the way, that provider is going to be so much more helpful for you. Hey, baby. The end. Mic drop. Stay shameless.